Hi, my name is Leah McKeskey. I'm an internal medicine doctor in Dallas, Texas. Being in primary care, I see a ton of people with hearing complaints, but my favorite is when someone has dementia or memory loss, and we send them to audiology and it turns out they just can't hear very well. In those cases, I think audiology really gives someone their life back.
In the world of head and neck cancer, there's a lot of exposure of patients to these ototoxic treatments such as radiation, cisplatin, and I think obviously one of the main concerns for these patients is the mortality from the cancers. But I think as they get through the treatments and start living a long life afterwards, their concerns become more towards the morbidity aspect. So hearing loss, their way of interacting with the world, and I think having audiology from the start would be an excellent idea to a lady's concerns.
Hi, I'm Marissa. I'm a PA and I work in a trauma center, and I think that audiology is very important to my clinical practice because it bridges the gap between the deaf community and our hearing community, making communication more effective and strengthening our rapport and the deaf community's experience.
I work inpatient neuro rehab. I know that audiologists are very important to the healthcare field, and especially in conjunction with physical therapists. As a physical therapist who works in neuro rehab, we have several patients who experience BPPV and also chronic low-level dizziness, and audiologists are people that we consult to help us work through the diagnosis and treatment.
One of the ways that audiology would fit into my practice as an ophthalmologist is for patients who are having trouble hearing and are preparing for cataract surgery. It's extremely important during the surgery, since the patient is awake, that they be able to hear any instructions. For those patients, I would probably refer them to an audiologist to make sure that they can hear correctly and have a safe surgery.
I think it also relates to the dentist himself. The previous equipment we had, high-speed handpieces, and the sounds from that year after year, I do think affects the dentist's hearing. As far as the patient is concerned, I think that you need to have instructions to a patient that you need to understand, and if they don't comprehend that, then obviously audiology could play a more important role.
I believe that audiology could fit into my practice, but I would need more information on what it entails. I think it could be really helpful for our neurology patients and patients who experience vertigo and migraines.